The Colon Therapy Center, Janet Eileen Mitchell, right out at Callaway and Brimhall. They're here in Bakersfield. People raving about the health benefits they're experiencing from this gentle therapy. The website at bakersfieldcolonics.com. Our great friends at Cruise Through Car Wash, 7 locations here in Bakersfield. Just 5 minutes in and you're out with a beautiful car wash.
We'd like to thank our friends over at Kern Construction and Electric Incorporated. Robert Miller, the longtime resident here, he specializes in the remodeling of homes and businesses. He can be contacted at 661-322-5554. Chuck and Wendy Noss, owners of Nature's Food Market and Juice Bar, for delicious, healthy food, fresh juices and smoothies, and the best advice about your good health. Visit them at 2000 H Street, right here in Bakersfield, across from the Fox Theater. Call to place an order at 661-327-4430 and like them on Facebook.
Dr. Vinod Kumar and his associates at the Vascular and Leg Center at 5020 Commerce Drive here in Bakersfield. Dr. Kumar has a passion and a new treatment to prevent amputations caused by diabetes. Go to his website at thevascularandlegcenter.com for information and an appointment.
Thank you to all of our sponsors for continuing to support Open Up.
Yes, sir. And we have the good doctor right here. Don Clark here,
Yes,
Tina Miller.
I'm Tina Miller.
Your favorite pair on the air. And hey, a special shout out today to our viewers in San Diego, Los Angeles, and over in Santa Barbara. Glad you're joining us.
Yes,
sir.
thank you.
Take us to the good doctor.
Don, one of our favorite doctors, is back with us, and this is Dr. Vinod Kumar of the Vascular and Leg Center right here in Bakersfield. He's here to give us an update on what's new in the center.
Tina, thank you very much. I'm
You're
glad to
welcome.
be here again, and I really appreciate you both
Thank
and
you.
the interest that you generate in the community to have a healthier legs
Yes.
and better care.
Well,
Yes.
doctor, we have viewers all over the world in 19 countries and across the nation. So what you're doing here in Bakersfield is revolutionary, and we want everyone to know about it. So
That's
tell us
wonderful.
about
Thank
it.
you very much.
Yes.
You know, what happened is there is a new procedure to help these patients who have the vein problems. You know, see, the veins, if they become incompetent and they are not able to do the job of bringing the bad blood back to the heart for circulating it again,
Okay.
then some of this blood stays back into the legs and feet. And as people are sitting and working, as the day progresses, the legs continue to build up this fluid and swells up.
Okay.
They start having cramps and discomfort, achiness. They have like Charlie horses at night, you know, those ugly looking
Yes.
veins in the legs. And all those things are because of these bad veins. And we've been trying to get rid of them for almost 40, 50 years. We used to do stripping, you know, it's a big surgical procedure.
Yes.
But then there's new inventions all the time. Almost 10 years ago, we started to do this procedure called the radio frequency ablation, the laser. Okay? And we've been doing that. It's working, you know. It's doing a great job.
Yes.
Okay? But recently, 2 weeks ago, FDA approved a new procedure.
Wow.
And we have been fortunate to have our hands on to that. And we were the first one in California to bring that to one of our patients in Bakersfield.
Just 2 weeks ago.
Just 2 weeks ago it was approved, and we did this procedure last week.
And how does it work? Tell us
Now,
about it.
Yes.
this procedure is called the vena seal. Now, what it does is it seals the veins
Okay.
rather than heating them or burning them or taking them out or cutting them. What this procedure does is we put a small, like a crazy glue or super glue inside these veins, and we put these vein walls together and the vein blocks. Okay? So this procedure was started by Dr. Rabe. He's in Seattle. He's a radiologist. And we've been using this super glue for other procedures in the body, like in the brain aneurysms or to stop the bleeding, to block the veins or the arteries, you know.
Okay.
And so he started to use those in the leg veins a few years ago and started to experiment on animals, and it worked, and then started to human studies. So far, 3,000 patients have been done all over the world. But United States, usually, you know how FDA is so strict, which is for the right reasons. You know?
Yes.
And unless it is really working, you know, we don't bring those procedures into community practice. So we just got this procedure approved, and so far 3 cases have been done in the United States.
3?
We have done 2 of them. And both of these patients are doing wonderful. Actually, one of our patients you probably saw in the newspaper.
Yes,
you know,
yes.
Mr. John Baker, after the procedure, he said, "You know what? I might go dancing tonight."
Yes, I read that.
Doctor, I don't get it. What does sealing the vein do? How does that work?
Okay, so there is many veins in our legs. There's some of the good ones and some of the bad ones.
Yes.
Okay? The good one, which are usually the deep veins, they carry most of the blood back up to the heart.
Okay.
Like Mr. Baker had these good veins, and they were trying to do the job. But now there are these bad veins. They don't let the blood flow, and they hold this blood. It's like the hiding places of the blood for the blood in the legs.
Okay.
So we want to get rid of those bad veins. We don't want the blood to be held in there.
Okay.
Because there are so many good veins that are doing the job. If we get rid of the bad ones, then the blood is not held here anymore.
Right.
So the blood starts circulating. It's not just like a pond sitting there, you know.
Wow.
Explain to our viewers why amputations have been necessary up to this point.
Well, amputations, anytime there's a lack of the circulation, lack of the good oxygen that our tissues need, you know. If there's a blockage in the arteries, that's most of the time, that's the reason for leading up to amputation. Like patients with diabetes, patients who smoke, you know, those are the two biggest groups. And then patient with kidney problems, patient on dialysis, patients who have the chronic kidney disease. Those patients have a tendency to develop this plaque building inside the arteries, and they gradually block. The problem with diabetic patients, they don't feel anything. They have neuropathy along with that, you know. And so they get minor cuts, or their nails are being cut, or something, a trauma happens, they develop this ulcer that eventually gets into gangrene because there's no blood to heal it. Anytime there's a trauma or a wound in our feet or leg, then you require at least 2 to 3 times of the blood there to heal that. And to start with, they have this narrowing or blockage, and now this wound does not heal. If it does not heal, then you're going to need to get rid of the tissues. So that's why some of these, first the toes, then the leg, then you know, below the knee, is like a process where unless you pay attention to the vascular system,
Right.
unless you improve the circulation, we are going to not be able to heal this. And so what happens is, imagine this, you know, there's a small wound, and we are creating the amputation without looking at the circulation. There's a bigger wound.
Yes.
How is it going to heal? And that's why these wounds don't heal. And what happens? Then it continues to have gangrene, infection, then we go a little bit higher. Oh, let's cut it here, let's cut it there. Well, that has to stop.
Yes.
Yeah.
And the way it has to stop is we start with what is the problem, the base in the root. The problem in the root is the lack of circulation, lack of oxygen, lack of the good nutrients, like the antioxidants, you know, like you gave me this juice this morning. Thank you, by the way. This
You're
is really
welcome.
wonderful, you know.
You're so
There's
welcome.
an old saying, there are 10,000 hacking at the branches of evil for every one striking at the root. And you're striking at the root.
Right, actually.
Instead of hacking
we
on.
have to get the long-term good results, to heal these wounds, to prevent the amputations, we have to start with the vascular system first. And unfortunately, there was a study done in the United States, and just about 2012 Medicare data is 50% of these patients who have these wounds, who are getting these amputations, don't have their vascular system fixed before that. It's happening throughout the country.
Doctor, is word of what you're doing spreading? Are you getting more inquiries?
Actually, there is a lot more, and we are
good,
actually
good.
interviewing for more people to enlarge the group. We can't handle the volume right now we have.
Let's put up your full screen. Have you got that, Chris? There it
Yes.
is. Dr. Vinod Kumar, the Vascular and Leg Center. Save a life, save a leg. And there it is. Is it thevascularandlegcenter.com?
Yes, it's
Okay.
the vascular and leg
All
center.
right, all right.
.com.
Thanks for being with us, Doctor. We want you back
Yes.
regularly to hear
Don,
progress
thank you,
on
and
this.
Tina, thank
You
you.
are so
I
welcome,
really
Doctor.
appreciate your
Yes.
enthusiasm. I see that when
course.
you talk about these legs and
Yes.
wounds and ability to walk. We
Yes.
have to have a healthier community,
Yes.
an amputation-free Kern County.
Excellent.
And I really appreciate both of you. I see that enthusiasm, the zeal that you have. I wish everybody has that.
I've had friends that go through these multiple amputations as they go higher and higher. It's one of the most terrible things I've ever
Yes.
seen.
This
And
is,
to have a solution for it right here in
Yes.
Bakersfield,
Yes, yes,
God
thank
bless
you.
you, Doctor.
Thank
Yes,
you. Thank you very
thank
much
you
again
so
for supporting this cause, and we all are together for that.
Yes,
All
indeed.
right.
Thank you.
Until next time.
Fashionistas, right?
Fashionistas coming up. We are looking forward to it, so stay with us.